साक्षात् परं ब्रह्म तस्मै श्री गुरवे नमः. శుభ సంధ్య అందరికి. సో కిందటి సమ్మరీ ఎవరైనా చెప్తారా? వాట్ వీ హ్యాడ్ గాన్ త్రూ ఇన్ దట్ లాస్ట్ క్లాస్. The idea of arsenic, the differentiation of Selenium and arsenic with cases. Anyone? Sir, చెప్పండి సార్. జై కుమార్ గారు, థ్యాంక్ యూ. హలో సార్, చెప్పండి సార్.
నమస్కారం సార్.
నమస్కారం అండి, చెప్పండి సార్.
So in the last class we had seen actually the difference between germanium as well as arsenicum, but there were a few important points which you had mentioned. Saying that if at all a person narrates a history of himself having some health issues after he has lost 10 lakhs or whatever amount, we should not immediately confirm it as him belonging to the right side of the periodic table, because he may have narrated it from his fact level. If at all the patient narrates the issue from the experience level, that is after crossing his fact, emotion and delusion, by saying that he is losing his capability and hence he cannot rely on anyone because they may betray or cheat him and that he has to be extremely cautious, failing which he may lose whatever is remaining, then he may be considered to belong to the right side of the periodic table. Because here the person is speaking about losing his structure, that's the main reason why he belongs to the mineral kingdom. Suppose if at all the person belonged to the plant kingdom, he would have expressed his experience as sensations, such as it is pinching me, or it is troubling me, or it is hurting me, etc., etc. Since the persons belonging to the plant kingdom speak in a biodimensional way, the opposite functional part is also expressed when probed by the physician or by himself. For this, you gave an example of a 63-year-old female patient who approached the physician with rheumatism of the left knee 2 years ago and was prescribed lithium tar. She was better, but for the last 2 months she had been suffering again with the same problem, with pain, swelling and dragging pain from above downwards. She was not eliciting any issue by herself to prescribe remedy either by the sensational method or by the tertiary or the materia medica. You knew the fact that her husband had passed away 10 years ago and her son was staying separately with his family. Then you had asked her why she was not staying with them. She answered that we couldn't have freedom. When you asked the meaning of it, she said that I don't have freedom, I feel sad. When you asked her...
Sir, excuse me. నాకు కూడా తెలీదు ఆ కేసులో సపరేట్ గా ఉంటున్నట్టు. యాక్చువల్ గా జూనియర్ అతను బాలగణేష్ అని అతను కేసు రాసుకుని మన దగ్గరికి తీసుకొచ్చాడు. అతను అడిగేట ఆ పాయింట్, మీరు మీ అబ్బాయితో ఉంటున్నారంటే అందిట ఆవిడ యాక్చువల్ గా. సో ఆ పాయింట్ మనకి తెలియదు. ఇట్స్ ఎ వైల్డ్ గెస్ అన్నమాట. పేషెంట్ మన దగ్గరికి వచ్చాక మీ వారు కాలం చేశారు, ఎంతమంది పిల్లలు, జనరల్ ఏరియల్ వ్యూ అంటాం కదా, జనరల్ ఏరియల్ వ్యూ. మీ అబ్బాయి ఎక్కడ ఉంటారు, మీ అమ్మాయి ఎక్కడ ఉంటారు, మీ వారు కాలం చేసి 10 సంవత్సరాలు అయ్యింది, ఓకే అంటే మా అబ్బాయి దగ్గర ఉంటాను, ఓకే మా అబ్బాయి దగ్గర ఉంటాను కానీ వేరేగా ఉంటాను, సపరేట్ గా ఉంటాను, అదనమాట. ఓకే, కంటిన్యూ.
So when you asked why she was not, why she was not staying with them, she said, she replied that she wouldn't have freedom. When you asked the meaning, she said that if she didn't have the freedom, she felt sad. When you asked her to elaborate, she was telling that she would be looked upon very cheaply. And when you asked to elaborate a little more, you got nothing. At every stage, there was compensation from the patient. Then at last she said that daughters-in-law these days are educated and they don't feel the responsibility of looking after the elders, especially in-laws. This makes me uncomfortable. When you asked about the meaning in that, she said that as if I am being looked down. And when you asked how she was feeling at that particular point of time, she felt ashamed. She said that she felt ashamed. And after a 5 minutes of pause, she said that she wished her husband was alive. And when you asked what would have happened if her husband was alive, then she told that it would have made her confident and courageous. When you asked about the meaning of courage, she said that it was support. And when you asked the meaning again, she said that it is enough if my husband was beside me as a support. When you asked in which way, she answered that it was in all situations. When you asked the meaning, she said that every month she would be getting the pension. This particularly meant that her need was regarding financial issues. In this case, there was sadness, unhappiness, crying and weeping in the emotional level. Daughter-in-law was not taking proper care of her in the factual level. Here the hot spot is that she longs for freedom and individuality. She expressed that she was being looked down in her delusional level, and here she expressed that she felt ashamed by being treated in that way. But the experience of the person confirms her need for support, especially in issues relating to money, which puts her in the second column of the fourth row of the periodic table. So, you also stress the point that the physician needs to carefully understand the kingdom to which the patient belongs, because the patients do not actually have the knowledge of these issues to answer in a way by which their kingdom or remedy can be understood by the physician. It is the duty of the physician to decompensate or understand the failure state of the patient and arrive at the correct remedy. There was a case, a 55-year-old male patient who was complaining about pain and swelling of left middle finger and thumb. And they feel as if they are stuck and unable to move them, as in rheumatism. He was diagnosed as rheumatoid arthritis by allopaths. He was also suffering from backache from the past year and hemorrhoids since the last month with excoriation in the anal region. He was also suffering from pain in his shoulders, and they become numb whenever he goes to sleep by putting his hand under his head. He has dust allergy and sneezing problem when exposed to cold air. He also has knee joint pains, wherein he feels heaviness, stuck and hot feeling in his left knee, which makes it difficult for him to move from a resting position. Occasionally he has pain in his left hip and some problem in his left elbow. So you asked him from when he was having these problems. He answered that he was having for the last 1 year. And also he said that around 2.5 years ago, there was a gash behind his right shoulder and he had used allopathic medicines. Then you asked what had happened before he got these problems. He told that his brother-in-law had passed away due to heart attack 1.5 years ago. And he also said that he had health problems from then on. And lately he has been disturbed due to the ill health of his daughter. You asked in what way he was disturbed, and he said that he was feeling tense. When you asked the meaning, he said that she was having severe itching due to skin allergy, and she prefers to suffer instead of using allopathy medicines for her problem. And that actually makes the father sad. When you ask the meaning, he said that it started as a small spot and now has spread with itching and sometimes bleeding, which is worrying him that something might happen. When you asked him what might happen, he said that it may affect her whole body. The problem might have originated due to some because the problem might have originated due to some problem with her blood. If this problem increases, her whole body may be affected, and it is worrying because she is not yet married. Then you asked him, how would you feel if someone other than his daughter is in the same situation? He said that others cannot even bear it, only my daughter is able to bear it. And due to this problem, his daughter is getting very angry, irritated and reckless. And he was also worried that his son wasn't attending online classes and always keeps playing games. Due to these behaviors, he was also getting irritated. And then your question was, what would happen if they don't listen to you? He said that their future might be affected. When you asked the meaning, then he said that here you pointed out that though he had not answered, though the answer was out of the situation, but maybe this belonged to his hotspot. So, giving an answer, he said that when you ask the meaning of their future being affected, he said that if there are customers to attend to at the shop, and there are no attendants to attend to the customers, I feel tense. Though this may seem out of context, it is the hotspot for the person probing, which may lead to his delusion and experience levels, because for him, the main issue is that he feels tense if the customers at his shop are not attended to. Then you asked what he means by tension. So his answer is, when there are more number of customers, I alone am not able to handle them and I get angry and irritated. And when you ask him what if attendants don't come, he says that it would be a loss. When you ask the meaning, he says that if the attendants are present, it would help him in attending the customers and avoid loss of articles due to mischief of some customers, which is nearer to an arsenic future. And it also assists in managing his business properly and reduces his burden. When you ask the meaning of burden, he says that it is the work burden. When you again ask him, he says that due to the burden I get irritated and tense. So it is evident from the narration that his worry is about him not performing his business properly without someone's support. When you ask him to elaborate, he says that if the customers are not attended in time, we may lose them. I get anxious of losing the customers due to my inability to cater to them in a timely manner. Then when you ask what worse could happen if you lose the customers, he actually didn't answer it properly until you probed him twice or thrice. Then he said that earlier he was interested in making money by increasing the business, whereas now since he is growing old and getting health problems, he is unable to do the business. So he was also thinking of quitting the business once his children are settled in their respective lives. Even now, for the last 1 year, business had reduced considerably. He was just continuing just for the sake of it. Earlier, the workers used to work hard, but they left, and from that time onwards, I have been getting more tense and irritated. And he also said that he had come to a point where he was feeling that he can't do business anymore. When you asked about what tension means, he said that he felt it because of lack of workers. And when you asked if workers are there, Then he said that the work burden will be reduced. Earlier, if an item was missing, I used to be informed about it. It's not the case now. It is not the question of attendance. I am unable to sustain doing the business. So, the loss of ability, capacity or the capability is clearly indicating the mineral kingdom here. And the patient is conveying that he is losing his ability which pertains to the right side of the periodic table, which may either be the gallium, germanium or arsenicum, which is with regards to his business, career, health, etc. of the row 4 issues. When you asked him about dreams, he said that he used to get dreams of movie heroes and he used to feel happy. When you asked him what happy means, he said it is not being sad and not having problems. As if he was feeling as if he was singing songs and dancing and fighting bad guys, as if he was fully energetic and powerful, which made him again happy. This energy, power, capacity and capability is the exact opposite to his present condition where he is feeling powerless, incapable, incapacitated, etc. When you then asked about a stressful event in his childhood, then he said that it was the death of his maternal uncle when he was 12 years old. He was regularly seen in his dreams. And it made him sometimes fearful and make him wake up suddenly. His uncle was very affectionate towards him and used to show him around. He taught and helped him in business. Such a close and affectionate person suddenly committing suicide and dying made him very sad. So the issue even with his maternal uncle is that he helped the patient, the uncle helped the patient in learning how to do business, which again is indicate his career, which is the issue of the fourth book. When asked about fears, he said that he was fearful of his father, and he feared even talking to him. All his brothers and sisters were fearful of talking to his father, because he used to be serious all the time, though his paternal uncles used to be very jovial. When asked about hobbies, he said that he played badminton, cricket, etc., but he used to like cricket till it was revealed that the cricket was not being played properly for the sake of the country and was being played for the sake of money. So he came to understand that all this was a farce in guise of match fixing, and he stopped watching the matches. Even in this particular point, he was showing the basic point that he had stopped watching cricket because it was a loss. And again, he told a story about his friend defrauding him in spite of helping him a lot. In this way, most of his friends he had helped and was cheated. When you asked him why, in spite of being cheated earlier, why did you help others? Then he said that that is my misgiving. I used to think that I wasn't giving them money for free but for interest. So the inference here is that he used to give money even to his friends for the sake of interest, though he has been saying that he was helping them. He thought that whatever interest was earned would help his family if he lent the money for interest. Then when you asked his ambition in life, he said that he worked very hard under his father, and he wanted his children to complete higher studies, but he didn't have the strength, ability, power at this point of time. He said that he had lost all his strength, but somehow he wanted to make his children settle down in their lives at a certain level. That was his life ambition. This differs from arsenic here because the arsenic patient will say that he can't do anything, he would want his children to do something for him because he is weak. So he was administered germanium, and after 6 weeks he was 80% better of his pains. Shoulder pains are totally absent, but slight knee pains are still there, and he is free from his dust allergy. His backache is better, his fingers pains is much better, the mental stress is better, and he is not feeling that much of pressure he felt earlier. So this gives the classic case of germanium, which shows the loss of ability, structure or capacity or capability to protect or give something to their family with regards to health, wealth, career, etc. We also have to be certain and conscious to see whether it is an absolute need for the person to have somebody which has to be expressed in the experience level also, as expressed in the above case, that he would have been comfortable if there were attendants turned out as not the real issue later on in the case. Or else the remedy might be misunderstood to be a salt. So in the above case, the experience was not that he wanted attendance, but the experience was of loss, which had already happened, but he must do something to protect which is remaining. In arsenicum, a lot of suspicion creeps up and he doesn't believe anyone. He is extremely weak, cautious and defenseless and totally loses the ability to protect. He feels that people are taking advantage of him. Due to this nature, he does his things himself without depending on anybody. Whereas in germanium, he is on a losing path, but still he makes some efforts to at least retain whatever is remaining with him. Here the suspicion issue does not arise, though there may sometimes be a hint, since it is placed before arsenicum in the periodic table. Arsenicum, next you told about arsenicum, which belongs to the cancer miasm according to Dr. Shankaran. This particular miasm has fear, suspicion, restlessness, mistrust, that they are weak and defenseless, due to which people are taking advantage of them, which may include their family members, that there are robbers and thieves. These persons are weak and hence need support of others, but they never trust them due to their suspicious nature. These people repeatedly talk about money matters. Their constitutional picture revolves around the money aspect mainly. Their cautious nature is seen in all aspects related to relationships, health, etc., and especially in the money matters in their compensated state. They even harass the physician, whom also he doesn't trust, due to which he takes people's opinion about the physician. So you gave some examples about the harassment the physician faces, saying what to eat and what not to, what to do and what not to do, and why, due to their anxiety and cautious nature. Due to this attitude, these people become more and more restless. When the person comes to such a position, all the rubrics whichever are given in the repertory, such as fastidiousness, censorious, fault finding, etc., develop in him. So we need to see the pattern which is basically engraved in him rather than the rubrics, such as knowing that the rubric of fault finding in such a person is because he is weak and can't independently do his own things. And he is censorious because he is mistrustful. For that you gave a case of a 35-year-old pastor who was suffering from diabetes from the last 4 to 5 years. And he was so methodical that he used to keep all the reports arranged in such a manner so that the physician could be seeing them month after month. Such precise nature belongs to these arsenic persons. And there are a lot of delusions in arsenicum. They have the delusion of thieves, delusion of criminals, delusion of others conspiring against them, delusion of receiving injury, delusion of being watched, etc. All these delusions are due to the basic characteristic features of arsenic, that is mistrust, suspicion, weakness, restlessness, fastidiousness, and prostration. You also said about a gold cane-headed patient, which actually I never had learnt about. I request you to just tell about it later on, sir. Prostration, offensive discharges, restless, despite being unable to move out of his bed, are developed by patients when they fall into the failure part of arsenicum. Similarly, you gave another case of a 70-year person who was suffering from tremors of his right hand while talking, tremors of legs while standing, and he was also a diabetic and hypertensive. He was using allopathic medications when he first came to your clinic. He was also suffering from burning of soles, edema of legs, stiffness of joints, and he was diagnosed as having Parkinsonism. He also had a stent in his heart. He had undergone surgery for scrotal hernia. There was also a history of Parkinsonism in his family. He had desire of spicy foods and he felt prostrated. He had eruptions and itching on groins, back and thighs since 1 year and is also using allopathic medicines for them. He also has the fear that the eruptions may increase and spread all over the body. Actually, he had dreams of his agricultural farms and children, and he is always anxious. And he was also using medicines for insomnia. He is anxious about his children before going to sleep. He feels that he is weak and cannot do farming, and so wants to sell his agricultural farm, because he is feeling that he no more has the capacity to do the agriculture. His children are doing good in their own jobs, and so they are in no position to do the farming. Hence he wants to sell the farm, construct a building, so that he can earn some money by renting the building. And he doesn't want to stay with his son. He feels that he has the responsibility to look after the farm, or somebody may take advantage of it and grab it, and hence he doesn't want to go to his son. He feels that he wants to look after his children when they are sick, but at the same time he is having the responsibility to take care of the farm. But he feels that he is too weak to look after the farm by himself. And as well as he also feels weak to look after himself. He feels that in spite of his illness, he has to take care of the land. And also, due to Parkinsonism, he is unable to walk and feels that he may fall down on the ground. 3 months ago, he was able to walk and ride on his own, but now he is unable to do so because of the tremors. He fears that if Parkinsonism increases, he cannot work on his own and has to depend on others. He feels that since the land belongs to him, he needs to look after it on a daily basis, at least for an hour. Only then he would be satisfied. When asked what satisfaction means, he said that earlier when he had gone to his son's house, robbers had taken down into his house and robbed him of some money. And whenever he visits his son's place, from that time onwards, he doesn't feel comfortable till he returns back to his house. So, from this incident onwards, his fears had increased. That particular incident may be repeated, and somebody may even try to take away his land. So, his anger, tension, sadness reflect on the right hand, and the tremors increase due to his fear. He feels that everybody will come to know about his fears due to this particular tremors. He gets angry when servants are late for work, and he also fears that the servants will take away the coconuts from his house. So this was what actually he was giving, and initially bromatum 200 was prescribed, but he didn't have any change. So then you retook the case, and when you asked why is the problem, he said that Parkinsonism had spread to his right leg from his earlier left leg, and it had been aggravated in the last 1 year. When you asked about any change after the earlier remedy, he said that there was no change. It was as it was a month ago, and his irritation had increased. When he was having more irritation, restlessness or fear, the tremors were aggravated. Then, when you asked about his stressful event, he said that it was his wealth. When you asked him to go ahead and explain, he said that God had given him wealth, which he needed to safeguard from others stealing it. He didn't believe others, so he himself wanted to look after it. When you asked the meaning of it, he said that we need to do our duty, and how can we believe others? They may steal his wealth, he should take care of his own wealth. That is why he is doing the farming without leasing it to anybody. And lately he has become weak due to this hard work. And he also said that he could neither believe anybody nor he could do the farming himself. So he was clueless. When you asked him how he felt at that particular moment, he said that he became weak and he had to take care of the farm from being robbed of it. So then you prescribed Arsal 1M in February. The tremors had reduced a little. He couldn't continue the treatment due to the lockdown. His symptoms increased in August and the remedy was repeated. His tremors and burnings reduced when a recent feedback was taken. The fluctuations of diabetes and hypertension got reduced. His anxiety had reduced very much. He may, in future, may have to be administered 10M. And later on a question was asked how to differentiate between insecurity and suspicion, which I was not able to attend, sir.
Okay. Thank you, sir. Thank you so much. Nice. Very nice. Exactly. So I think most of us has again refreshed with the germanium aspect and the arsenic aspect. So the gold-headed cane patient is nothing but a phrase used to describe the fastidious nature of arsenic album. The mania for neatness. మాస్టర్ గారు బాగా చెప్తారు దాని గురించి. ఒక సూపర్ ఎగ్జాంపుల్ ఏంటంటే, ఒక గడియారం కనుక ఆగిపోయి ఉంటే ఒక ఇంట్లో, వీడు ఒక అతిథిగా వెళ్ళాడు, ఆర్సనిక్ ఆల్బమ్ పేషెంట్. ఆ ఇంట్లో గడియారం ఆగిపోయి ఉంటే వాడు హీ బికమ్ సో మచ్ రెస్ట్లెస్, హీ వాంట్స్ టు కరెక్ట్ ఇట్. అదొక పాయింట్. ఈవెన్ అంత దూరం కాకుండా, ఈవెన్ అది హ్యాంగింగ్ లో కూడా, టైం మాట దేవుడు ఎరుగు, హ్యాంగింగ్ కూడా సరిగ్గా లేకుండా పక్కకు ఉంది అంటే he becomes so much restless, he wants to correct it. Such is the mania for neatness, mania for preciseness, which was there in the arsenic album. So it was expressed as that gold-headed cane patient, nothing more than that. To express the word more precisely, they used that phrase. So it comes under the mania for neatness. But again, as in the last class, what we had gone through is that we have to understand the basic quality behind it. అంటే ఉదాహరణకు ఒక ఇది చెప్తాను. ఒక ఆయన మా డిస్పెన్సరీకి వచ్చినప్పుడు, ఆయన ఎప్పుడు బండి ఏం చేసేవారంటే, అందరూ బళ్ళు ఇలా పెట్టుకుంటారు స్ట్రైట్ గా, ఆయన ఏం చేసేవాడంటే బండి పెట్టేటప్పుడే వెనక్కి తిప్పి పెట్టేవాడు. అంటే ఎందుకయ్యా అలా పెడతావు నువ్వు అంటే, వెళ్ళేటప్పుడు ఈజీగా ఉంటుందండి, మనం పెట్టేటప్పుడు కనుక ఇలా పెట్టుకుంటే మళ్ళీ అన్ని తీయడానికి ఇబ్బందిగా ఉంటుంది. అలా కాకుండా ముందే తిరగతిప్పి పెట్టుకుని ఫ్రంట్ వీల్ మన కేసు ఉండేటట్టయితే అది తీసుకునేటప్పుడు వెళ్ళిపోయేటప్పుడు చాలా ఈజీగా ఉంటుంది అని ఒక ఐడియా ఇచ్చారు. సో యాజ్ అ నార్మల్ ఫిజిషియన్ నాకు ఆ రోజుల్లో ఏంటంటే ఇది చాలా ఇదిగా అనిపించేది, చాలా పెక్యులియర్. ఈ పేషెంట్ ఆర్సనిక్ ఆల్బమే సో ప్రిసైజ్, సో ఫాస్టిడియస్, సో లుకింగ్ అని. కానీ దట్ రెమెడీ నెవర్ హెల్ప్డ్ ద పేషెంట్. ఎందుకంటే బికాజ్ ఇట్స్ జస్ట్ ఏ క్వాలిటీ. ఆ ఒక్క క్వాలిటీ చూసి దట్ ఈస్ ద నేచర్ డ్యూరింగ్ ద గుడ్ ఓల్డెన్ డేస్ వేర్ వీ జస్ట్ హ్యాడ్ గాన్ త్రూ సమ్ ఐడియా ఆఫ్ ద పేషెంట్. ఏదో ఒక కోణం మనకు తెలుస్తుంది ఒక వ్యక్తి గురించి, ఒక రోగి గురించి మన దగ్గరకు వచ్చినప్పుడు ఆ కంప్లీట్ అండర్స్టాండింగ్ ఆఫ్ ద పేషెంట్ కానీ లేకపోతే రోగి తాలూకు మొత్తం టోటాలిటీని చూడకుండా జస్ట్ ఒక క్వాలిటీ ఏదైతే హైలైట్ అవుతుందో ఆ క్వాలిటీని చూసి మనం ఒక డ్రగ్ డిసైడ్ చేయటం అనేటువంటిది ఎర్లీ డేస్ లో మనకి హెల్ప్ అవుతుంది. అది తప్పు కాదు, డెఫినెట్ గా ఆ రకంగా కొంత ఇంప్రూవ్మెంట్స్ వస్తాయి కేసెస్ లో, డెఫినెట్ గా ఎంతో కొంత ఇంప్రూవ్మెంట్స్. బట్ ఇన్ ఎ లాంగ్ రన్ వీ హ్యావ్ టు evolve, we have to educate ourselves, we have to make us a clear cut study that instead of looking at one part of the case we have to see the person as a whole. And to see the person as a whole, it is the stressful area of that particular being that we have to verify, check, or to have a clean look. Who is this patient sitting in front of me? To get a clear-cut totality or the portrait of the whole disease or the experience of that particular person or the sensation, it is the stressful area that we have to see, or we have to have a clear-cut check rather than seeing the highlighted area. బండిలా పెట్టుకున్నాడు, గడియారం ముళ్ళు తిప్పాడు, ఆర్ సస్పీషియస్ క్వాలిటీ ఉంది, మానియా ఉంది, నీట్నెస్ కి. దీస్ ఆర్ సమ్ క్వాలిటీస్ అండ్ టు అండర్స్టాండ్ ద టోటాలిటీ, ద ఎక్స్పీరియన్స్ బిహైండ్ ఇట్. సో ఈవెన్ నీరజ్ లాస్ట్ దాంట్లో అడిగిన డౌట్ కూడా, ద డిఫరెన్స్ బిట్వీన్ ఇన్సెక్యూరిటీ అండ్ సస్పీషియస్. బ్రాడర్ difference is that this insecurity creeps from lacking something. That just a word differentiation. Lacking something is insecurity, and suspiciousness creeps up from losing something. Already had something, he or she becomes suspicious that will be lost from him. It's a brief description to have a clear-cut demarcation. But again, it's just an quality. We have to understand the basic quality of the person which is at the background, from which these emotions or these rubrics or these qualities are cropping up, are sprouting up. What's the field in which these plants are growing? That is the thing we have to cultivate within ourselves, to see the person as a whole, to see this person. Today also I had got a case, a beautiful case, where the person complained that he is facing some interviews, so he is suffering from inconfidence, so there will be sweating in palms, a lot of fear to face an interviews, how the future will be, etc. And there is some aggravation from cold air. And the junior doctor who had gone through the case came to the conclusion that it's a case of silica. So this is all we know something. We know about silica. We studied about silica. We had gone through the Kent Materia Medica. We had gone to the Rajan Sankaran sir's Soul of Remedies. So we had gone with the Sekar sir's Mineral Remedies. So we had gone with all these things. And the very knowledge which we had got from these sources had made us to see silica in that case. So he came to me and said that it's a case of silica, sir, no doubt about it. So I asked the person to sit down. He said, so what's the main problem? The main problem is cold, sneezing, running nose, nose blocking. There is throat pain, and there is itching in the throat, soft palate and in the throat. These are the main complaints. So what happens? So he said that with these complaints, he will become irritable. He will become restless. He will scold his mother, sister, father, etc. during that period. It's uncontrollable. And then he will become drowsy. He wants to sleep. He wants to take rest. He wants to be absolutely with lights off, with no sounds, to take so much rest and sleep. So this is the thing we got. ఇలా మనకు వచ్చినప్పుడు ఒకసారి మనకు ఎప్పుడైతే ఈ టైప్ ఆఫ్ ఇది వచ్చిందో, now we will go through the other points of the case. Yeah, rest and repose better. And because we had seen Silesia, we with the mind, so just put off the silica aspect from our mind, see the case as a whole. Now the interest, the hobbies, he wants to go tourism, he wants to go all the history places, he wants to go out, he wants to have a look after them. And the stressful area about the fear of future, what happens if he does not get job? He completed his BTech degree, now in search of job, he will remain in the home. So with all these things and with other areas also, we had gone to the fourth subclass of the plant remedy, the Diellidae, where the entire aspect is about being in the home. Remaining silent, calm, quiet, drowsy, sleepy, ameliorated by rest, wants to be lie down. And the opposites gets disturbed, irritable, does not want to talk, will get angry when he talks, will scold if he gets disturbed during that period, because the cold and sneezings are his stressful area. And what's the remedy? What's the family and what's the remedy? Bryonia, very good. Violels, very good. It's Bryonia. It's Violels family, where the issue is gets disturbed, and with the functional part, to take rest, calm, drowsy, sleepy, does not want to be disturbed. So what happened with this, why I presented this case today, is to get that idea that to enter into a person's totality of the, we should see the stressful area of this person. Otherwise we will easily gets into an error by seeing what we already knew about this person. ఇదివరకు కూడా చాలా సార్లు చెప్పాను మన స్వరా జర్నీలో, మనం చేయాల్సింది మనకి ఏది అర్థం కాలేదో దాన్ని చూడటం. కానీ నార్మల్ మైండ్ ఏం చేస్తుందంటే, దట్స్ ద బిగ్గెస్ట్ ఆబ్స్టెకల్. we will tend to see what we already understood in this case. మనసు ఏం చేస్తుందంటే ఓకే వచ్చేసింది ఇంకా అనవసరం అబ్బబ్బే నువ్వు అవన్నీ అడక్క అనవసరం ఇంకా అన్నట్టుగా మనకు చెప్తూ ఉంటుంది మనం. సో ఇమీడియట్ గా సిలికా అన్నాడు, అవన్నీ సిమ్టమ్స్ కూడా ఉన్నాయి. సో ఇట్స్ గుడ్ స్టార్టింగ్ పాయింట్ టు స్టార్ట్ విత్ సిలికా ఇన్ దీస్ కేసెస్. బట్ వేర్స్ ద ఐడెంటిటీ ఆస్పెక్ట్? ఎక్కడ అది చెప్పలేదే. So the row 3 issue is primarily the identity. So I will be ashamed. మార్క్స్ తక్కువ వస్తే అందరూ ఏమంటారో నన్ను, లేదు ర్యాంక్ తక్కువ వస్తే ఏమంటారో, లేకపోతే ఉద్యోగం రాకపోతే ఏమంటారో, which not at all expressed by this person. So simply by seeing some rubrics or some part of his known part, the conscious part, prescribing any remedy will definitely help for some time, but it won't help for the long time. I don't say that it's not a good prescription. That's not good. Yes, even in the calibrome in the last case, it's a good prescription. That's a good thinking up to some part. So the physician who had attended the case had taken considerably well, but he didn't see the aspect of the row part. He just went through some rubrics because the repertory hindrance. When some ex-person will want to show some knowledge of his repertory skills, or he had completed some degree in repertory or some other things, then the case will get into such a problem that this guy is, whoever attending the case will push the rubrics into the known part of the case, will take the rubrics only in the known part of the case. So these type of errors will come. But what we have to do is, in such type of cases, see the unknown part of the case. So where this person's primary stress is lying, it is this cold part, this sneezing part. It is hindering me. In what way? No, I am getting irritable, scolding my parents, scolding my sister. So what? I become extremely disturbed during that condition, extremely irritable during that condition. It's a restless period. So one of the questions in SODP was asked, what's the difference between vexation of violence and vexation of ranunculaceae? So the idea here is, the violence, vexation will come from such a aspect of some physical issues. There are so many physical, yes, except colocynth, all the remaining violence remedies will give you the idea that the person becomes extremely restless, violent, terrible, disturbed, irritable, etc. by some long-lasting physical ailment. The ailment at that period of time will create so much violence in this. So as Gautam said 2 days before, the sensation is violence and the function is silence. As beautifully explained by him, the violence issue is, the sensation is violence and the functional part is silence. So the only part I didn't understood in this case is the idea of tours, the idea to visit historic places, the idea to go all through the India, travel all through the India. So when I didn't understood this part, I went to the subclass understanding. The fourth subclass, the Diellidae, where we have the families Cucurbitaceae, Malvaceae, Phylales, Cistaceae. So all these families come under the fourth subclass of the plant kingdom according to the recent development. So where the idea here is, the fourth subclass idea is to be comfort in a comfort zone, happy in a comfort zone, rest. So they are compared with the fourth row of the periodic table. The fourth subclass of the plant kingdom comes under the superclass understanding, where these one of the plant subclass and one of the animal subclass, animal kingdom, and one group from the mineral kingdom are termed, are combined into one superclass. So that superclass, the fourth superclass, is the fourth subclass of the plant kingdom, Diellidae. The gymnosperms understanding, the gymnosperms in the plant kingdom, the fourth row of the periodic table, and the mammalian understanding, the mammals. So yeah, that is the chart. So where the functional part in the fourth superclass or in the fourth subclass of the plant kingdom is tours, to go outside, to explore. Now the case got fitted, where the sensation, function and the tours aspect, travel aspect is nothing but coming from the superclass understanding. Now we can prescribe more confidently. The only thing I didn't got is the miasm part, where the person had said that during the time he will get isolated. But in the remaining areas, all the areas, he said that he is a positive person. He didn't worried about any fears. The only fear is that about the job. And in that also, he has the confidence that he is going to get job. But up to that point where he didn't get job, he is a little bit frustrated. Again the same experience. Irritable. So this is the way we are going to understand a case. From as is it we are going from the known aspect or from the unknown aspect. So when we start with the known part of the case, we tend to prescribe with our mind, with our brain. So we knew so much about materia medica. We knew so much about Kent materia medica. We knew so much about Clark materia medica. We knew so much about Solaf remedies. We knew so much about so much repertories we have studied in our degree, academic education. So we want to exhibit our knowledge. We want to take the rubrics, repertorize it, instead of understanding this person as a whole. Even after understanding, we will get the same remedy. But in the prior issue, your mind is going to work. And in the later part, you yourself as a whole is going to take the case, instead of your mind which is going prior to you, which is taking the active part, which makes you not to see the person as a whole. So refrain from that point. When you get some understanding of the case, just prescribing or throwing some remedies doesn't help the case. So this is the idea where the idea of J. Kumar sir's doubts and Nera's doubts are combined to see the case as a whole. So now we move from the arsenic to the selenium part. So all of us knew selenium as a sexual weakness. We know the primary features of selenium. So I will start with my greatest failure in my practice, where I prescribed selenium 10m in a case. So I will start today with a failure case. So this is a person of age about 25 to 30 years, approached me 10 years back, long back. So he was diagnosed as azoospermia. So no sperm cells are there. So they couple came for children. So he had so much terrible sexual weakness. There are erectile dysfunction is there. So he will get tired with family life. So much symptoms, and the basic symptoms of selenium also, the perspiration, which was yellowish, bad odor on bunions, stains of yellowish perspiration on bunions. So these type of features are there. So immediately, those are my early days in practice. So I gave him, and one more point he mentioned is, అతను పౌరహిత్యం చేస్తాడు. ఒక రోజు ఇతను ఒక వేరే చోటకి ఎక్కడికో భోజనానికి వెళ్తే సడన్ గా అతనికి మోషన్ వచ్చింది. సో మోషన్ వచ్చినప్పుడు అతను అది కంట్రోల్ చేసుకోలేదు. మొత్తం మీద అక్కడ చాలా ఇబ్బంది పడ్డాడు అతను. సో ఇన్ లైఫ్ టైం ఇంకా ఇక్కడి నుంచి అతనికి ఆ క్షణం నుంచి కూడా ఇతను ఎప్పుడు బయటికి వెళ్ళినా సరే ఆ భయం అతనికి, నాకు దారిలో ఎక్కడైనా మోషన్ వస్తుందేమో, అప్పుడు ఎలా జరిగిందో అప్పుడు అంత ఇబ్బంది పడతానేమో. సో ఎక్కడికి వెళ్ళినా ఇతను బస్సులు అవి ఎక్కడం, బండి మీదే వెళ్ళిపోతూ ఉంటాడు. So this is the version given by the patient. But I gave him selenium 10m. కొంచెం అప్పట్లో ఆ పొగరు ఉండేది నాకు, to be frank. So nothing happened with the case. So I repeated after 4-5 months, waited for 1 year, 1.5 year, rechecked twice or thrice the sperm analysis. So there is nothing improved after one year exactly. 3 doses of selenium 10m doesn't help this person. So then the patient had stopped the treatment. So I respect that patient because he took a decision. మొన్నే మాట్లాడుకున్నాను నేను గౌతమ్. సో ఓ 2 ఏళ్ళు 3 ఏళ్ళు చూసి తగ్గకపోతే పేషెంట్కి మనమే చెప్పేయాలి, బాబు నీకు తగ్గట్లేదు మా దగ్గరికి రాకని. అంతేగాని ఏళ్ల తరబడి మన దగ్గర వైద్యాన్ని కట్టే పెట్టుకుని వాడికి ఏమీ ఇంప్రూవ్మెంట్ రాదు. ఇంకా అంతకన్నా ఘోరం ఇంకోటి ఉండదన్నమాట. వాళ్ళు మాత్రం అబ్బో అసలు శ్రీకాంత్ గారు ఆయనకు అసలు చూపు చూస్తే చాలు తగ్గిపోతుంది, ఆయన చెయ్యి పట్టుకుంటే చాలు తగ్గిపోతుంది అనేటువంటి ఒక ఫాల్స్ పెర్సెప్షన్ డెల్యూజన్ లో మనం వాళ్ళని ఉంచేసి నథింగ్ ఈస్ గోయింగ్ టు హెల్ప్. సో దిస్ ఈస్ ద ఫస్ట్ కేస్ వేర్ ఐ ఫెయిల్డ్ థరోలీ ఇన్ మై ప్రాక్టీస్. So that is the better experience with selenium in my practice due to my ignorance. So now after few years, I had came across another case of selenium. So he is a headmaster. So he is suffering from joint pains, rheumatic pains. So he was diagnosed as C-reactive protein positive. So these are the important things in this case. So some physician had attended the case, he took the case, he gave some medorinum something, he has weak memory, like this. So this patient after 2 or 3 months of treatment came back to me. So I retook the case. So I started with the practice with the general survey, as in the old case which has discussed in the last week. So I started with the same type of general. So what's your name? Where are you working? So where is your family? What are your children doing? Like this. So he was a government school teacher and he took retirement early. He took ఏంటంటారు దాన్ని ముందే తీసేసుకుంటారు.
Voluntary retirement.
Voluntary.
VRS.
VRS. Yeah, VRS. So he took that voluntary and he came out. So I asked, why you volunteer? Then the picture, what we didn't expect in him. So he said, నేను చాలా వీక్ పర్సన్ అండి, నీరసం వచ్చేస్తుంది, పాఠాలు చెప్పలేకపోతున్నాను పిల్లలకి, డబ్బులు తీసుకుంటున్నాం కానీ పాఠాలు చెప్పట్లేదు. సో ఇంక నేను పూర్తిగా పని చెయ్యను ఈ వృత్తికి అని నేను నిర్ణయించుకున్నాను. కానీ భయం ఉందనుకోండి, అంటే చాలా డబ్బులు పోయాయి, విఆర్ఎస్ తీసుకోవటం వల్ల నేను చాలా లాస్ అయ్యాను. కానీ స్టిల్ నేను విఆర్ఎస్కి అప్లై చేశాను, ఎందుకంటే నేను ఇక ఈ వృత్తి చెయ్యలేను అని ఒక థరో నిర్ణయానికి వచ్చేసాను. ఆ విషయం నాకు అర్థమైపోయింది. దిస్ ఈస్ ద వెర్షన్ ఆఫ్ ద పేషెంట్. అండ్ వెన్ all the other symptoms for which medorinum was given, the poor memory weak for names, పేర్లు గుర్తుండవు, memory weak for places, and the early senility. For 55 years atanu 65-70 years laga atanu, so much baldness, బట్టతలు వచ్చేసింది మొత్తం అంతా. When these are coupled with this version of the case, ఇప్పుడు వాటిని కనుక మనం పరిగణనలోకి తీసుకుంటే, and one more thing is that the confirmatory symptoms, which is a direct question, are your bunions stained with the perspiration? అవునండి, కరెక్టే మీరు చెప్పింది, బాగా పసుపచ్చగా పడిపోతూ ఉంటాయి. Then selenium 200 was given in that case, and with selenium 200 we monthly one dose for 3-4 days, 3-4 months. So the CRP positive was returned. Now CRP got negative, so he was very much improved with selenium. All the joint pains etc was gone. He was completely new person. So okay, VRS వాళ్ళు మళ్ళీ వెమ్మంటే ఎవరు అని, but I gave him selenium 1M after 6 months and asked to stop the treatment. So it's a beautiful case of selenium in my practice. ఈ కేసు చేసినప్పుడు నాకు చాలా సంతోషం వేసింది, ఎందుకంటే ఏ ఫెయిల్యూర్ తో అయితే మనం ఏ మెడిసిన్ తో అయితే ఫెయిల్యూర్ మొదలు పెట్టామో, సో అదే మెడిసిన్ తో మనం ఆల్మోస్ట్ ఒక వ్యక్తికి మళ్ళీ జీవనాధారం ఇచ్చాం. సో మచ్ రీఫ్రెష్డ్ దిస్ మాస్టర్. పెద్ద ఆయన బాగా, అంటే అతను చాలా పెద్ద ఆయనలా కనపడుతున్నాడు, యాక్చువల్గా 54 ఎంతో, కానీ చాలా పెద్ద 65-66 అరౌండ్ 65-70 మధ్యలో ఉన్నట్టు అతను ఇది కనబడుతుంది. సో దట్స్ వన్ టైప్ ఆఫ్ అండర్స్టాండింగ్ ఆఫ్ సెలీనియం. సో అంటే ఇంకా చాలా పెద్ద కేసు, బట్ ఐ ఫర్గాటెన్ ద ఓపీ కార్డ్ నెంబర్, సో ఐ కుడెంట్ రీడ్ దట్ ఎంటైర్ థింగ్ ఫర్ యూ. So I use it to keep OP card numbers only from last 1 year, and all the previous cases I didn't remember them and I lost them also. Hope whenever I go through the old cases I will definitely post to you. That's one part. And another case of selenium is where it is a psychiatric disorder diagnosed as schizophrenia. She was about 30 years old, had a child of about 7 to 8 years. So there is so much, ఒకళ్ళు సిజోఫ్రీనియా అన్నారు, ఒకళ్ళేమో ఇంకోటి ఏదో రెస్ట్లెస్ డిజార్డర్ అన్నారు, ఏవో సైకియాట్రీ మెడిసిన్స్ కూడా వాడుతుంది. బట్ స్టిల్ ద మెయిన్ కంప్లైంట్ ఆఫ్ దిస్ పర్సన్ ఈస్, ఎవరైనా చనిపోయారు అని విన్నా, ఎక్కడైనా షామియానా చూసినా, అది పెళ్లి షామియానా అవ్వచ్చు, ఏ షామియానా అవ్వచ్చు, ఎవరైనా చనిపోయారని విన్నా, షామియానా చూసినా అలాంటి వార్తలు జరిగాయి అని న్యూస్ పేపర్లో చూసినా, టీవీలో చూసినా ఇమీడియట్ గా ఈవిడ బాత్రూమ్ లోకి వెళ్ళి ఒక 10 బకెట్లు నీళ్లు నెత్తి మీద పోసుకుంటుంది. అండ్ వాట్ హ్యాపెన్స్ ఈజ్, అది ఆ రోజులో 10 సార్లు జరుగుతుంది. అంటే ఈవేళ పొద్దున్న 8ంటికి షామియానా చూస్తే ఓ 10 బకెట్ల నీళ్లు 9ంటికి ఒకసారి, మళ్ళీ 11ంటికి ఒకసారి, మళ్ళీ 2ంటికి ఒకసారి, మళ్ళీ 3ంటికి ఒకసారి, 5ంటికి ఒకసారి, అలా 10 సార్లు దాకా ఆ రోజంతా ఆవిడ నెత్తి మీద నీళ్లు పోసుకుంటూనే ఉంటుంది. ఏ స్ట్రేంజ్ కేస్. So the husband had brought her. They went to a psychiatrist. So she is using psychiatry medicines also, but there was no improvement. So any help you can give. So I started with some remedies, and other doctor had given some remedies. Nothing worked for her. Oh, I gave Calicar first, but nothing worked. So I retook a case one fine morning. So I asked to husband to sit outside, and I inquired about this lady. So what's your complaint? So then she just explained the story part. So she was a only daughter to parents. The parents had married this person. షామియానా మీన్స్ పెళ్లిళ్ళకి వాటికి వేస్తారు కదా, ఒక క్లాత్ లా ఉంటుంది. టెంట్ కరెక్ట్, టెంట్. సో దెర్ ఈస్ ఎ లాట్ ఆఫ్ స్ట్రెస్ ఫ్రమ్ మదర్ ఇన్ లా సైడ్. మదర్ ఇన్ లా చాలా శ్రమ పెట్టింది, చాలా ఇబ్బంది పెట్టింది. ఈయనకేమో అప్పట్లో ఉద్యోగం సరిగ్గా ఉండేది కాదు. మొత్తం మీద తర్వాత ఏదో ఉద్యోగం సంపాదించారు కానీ అదేం పెద్ద స్టాండర్డ్ ఉద్యోగం కాదు. సో ఏ లాట్ ఆఫ్ ఫ్యాక్ట్ అండ్ స్టోరీ పార్ట్ లైక్ దీస్ థింగ్స్. సో దెన్ షీ స్టార్టెడ్ క్రయింగ్. సో ఐ అలౌడ్ హెర్ ఫర్ సమ్ టైమ్. సో ఐ ఆస్క్డ్ వాట్ హ్యాపెన్స్. అతనికి సరైన జాబ్ లేకపోతే ఏంటి అంటే, ఏందండి ఈ రోజుల్లో డబ్బు లేకపోతే ఏం లేదు కదా, అందుకని డబ్బులు ఉండాలి. మా పేరెంట్స్ కూడా అంతేమీ బాగా ఉన్నవాళ్ళు కాదు, పాప ఉంది, పాప ఫ్యూచర్ అలాగా, ఇవే ఆలోచనలు వస్తూ ఉంటాయి నాకు. అంటే ఓకే. సో బట్ అవర్ కంప్లైంట్ ఈ సైకియాట్రీ డిజార్డర్ కదా. సో ఎట్ వన్ పాయింట్ ఆఫ్ టైమ్ ఐ మేక్ హెర్ టు కామ్ డౌన్ అండ్ ఆస్క్డ్ వై దిస్ కంప్లైంట్ స్టార్టెడ్. అదే నాకు తెలియదండి, ఎలా మొదలైందో అర్థం కావట్లేదు. పెళ్లికి ముందు లేదు, మరి పెళ్ళయిన తర్వాత ఎప్పుడు ఉంది? పెళ్ళయిన తర్వాతే స్టార్ట్ అయింది. మెయిన్గా మా అత్తగారితో సమస్యలు తర్వాతే నాకు ఈ కంప్లైంట్ స్టార్ట్ అయింది. ఎప్పుడు స్టార్ట్ అయిందో గుర్తులేదు, సడన్ గా స్టార్ట్ అయింది. ఆ స్టార్ట్ అయిన దగ్గర నుంచి చాలా డాక్టర్స్ తిరిగాం, సైకియాట్రీ మెడిసిన్స్ వాడుతున్నాం. ఏం వాడుతున్నా కొంత ప్యాసిఫై అయితే అయింది తప్ప ఇవి మాత్రం కనబడకూడదు. టీవీలో కానీ న్యూస్ పేపర్లో కానీ మరణ వార్తలు వినకూడదు, షామియానా కనబడకూడదు. లేకపోతే ఆయనైనా వాళ్ళ ఫోన్లోనైనా ఎవరైనా ఫోన్ చేసి వాడు పెదనాన్న పోయాడనో ఇలా చెప్తే ఇంకా ఆ రోజు ఒక 10 సార్లు తలస్నానం చేస్తారు. దిస్ పర్టిక్యులర్ థింగ్ ఈజ్ నాట్ ఎట్ ఆల్ కమింగ్ డౌన్. సో వాట్ హ్యాపెన్స్ డ్యూరింగ్ దట్ టైం? అదే నాకు చాలా బాధ వస్తుందండి. ఓకే, చెప్పండి దాని గురించి. సో ఆఫ్టర్ about 40 minutes, 1 hour during this story, fact, emotions, then slowly pushed herself in the delusion path. So the main idea from the childhood is the security thing, because they come from the poor economic background, wants money, couldn't handle that feeling of not having money. ఆర్థిక పరిస్థితి ఏంటి, మన పరిస్థితి ఎలాగా? సో మచ్ థింకింగ్, ఓవర్ థింకింగ్ ఈవెన్ ఇన్ ది చైల్డ్హుడ్. అండ్ వై యూ దెన్ వాట్ యూ డిడ్ నో సార్? నాకంతా నీరసంగా ఉండేది అప్పుడు చిన్నప్పుడు షీ హ్యాడ్ సమ్ ఫిట్స్. ఫర్ ట్వైస్ ఆర్ థ్రైస్ షీ గాట్ ఫిట్స్. సో షీ సెడ్ నేను చాలా నీరసంగా ఉండేదాన్ని, ఫిట్స్ వచ్చాయి 2-3 సార్లు, అందుకని ఏ పని చేసేదాన్ని కాదు. దాని గురించి చెప్పండి. అసలు నాకు ఓపిక ఉండేది కాదు, ఏదో ఒక జీవక్షవంలా పడున్నాను. దాని గురించి చెప్పండి. ప్రాణం ఉన్నా లేనట్టే అంటే చెప్పండి. లోపల శక్తి లేదు. సో ఏ కంప్లీట్ వీక్. ఫస్ట్ I got the raw, then I got the weakness of a complete loss, a complete giving up state. So there is no try even. So I started that. And one more thing, this is the area in the past which we got. And now, so what happens during that time? బాత్రూమ్ లో 10 సార్లు స్నానం చేస్తాను, ఆ గొడ్డలన్నీ అలా పడుంటాయి. ఆ బట్టలు ఉతకాలి, వాషింగ్ మిషన్ లో వేయాలి, అది కూడా నేను వేయలేను, కానీ మా పాప వేస్తుంది. అది 7-8 ఏళ్ల వయస్సు దానికి. అది ఎంత సహాయం, దాన్ని చూస్తుంటే నాకు ఏడుపు వచ్చేస్తుంది. అది అమ్మ నువ్వు ఎందుకు అలా చేస్తున్నావు అని అడుగుతుంటే నేను తట్టుకోలేకపోతున్నా. అది పట్టుకెళ్ళి వాషింగ్ మిషన్ లో వేస్తుంది, నేను తడిపిన బట్టలు. సో వాట్ హ్యాపెన్స్? అయ్యయ్యో పిల్లలే కదండి, వాళ్ళు ఇది ఆడుకునే వయసు, ఇంత బరువు బాధ్యతలు వాళ్ళ మీద పడటం అది కరెక్ట్ ఎలా అవుతుంది? అయితే బరువు బాధ్యతలు పడితే అది నేను ఫేస్ చేశాను చిన్నప్పుడు. So the same again, she came back into the old past where she again narrated those things which she said earlier, that there is so much weakness, I was suffered from epilepsy, no energy in me. So పాప వాషింగ్ మిషన్ లో బట్టలు వేస్తుంటే జస్ట్ ఆ పర్టికులర్ టైంలో నాకు ఎంతో హెల్ప్ చేయాలని ఉంటుంది. ఓకే మరి చెయ్యొచ్చు కదా. లేదండి, చేయలేను నేను. ఏ కంప్లీట్ లాస్ట్. అస్సలు పని చేయలేను, ఒళ్ళంతా నిస్సత్తు అయిపోతుంది. ఆ చిన్నపిల్ల చేత పని చేస్తున్నానన్న బాధే తప్ప అంతకన్నా నేనేం చేయలేను. So this is the experience she had been narrated. There is no sexual system here, but I still, because of the raw issues and the give up state, a complete lost, no try even, no suspicion, no fastidious, no robber thieves, nothing. A complete lost state, a complete give up state, a complete end up state, which made me to prescribe selenium in this psychiatric case. కొంచెం దమ్ము ధైర్యం కావాలి, but still I pursued with my selection because I knew that it was not given anywhere that selenium will be indicated in these psychiatric disorders, obsessive compulsive disorder, a schizophrenia. She has 3 or 4 diagnoses by different psychiatrists. And the miracle is, on even the selenium 1M was given. So with the first dose, this idea of bathing for 10 times had reduced to 5 times. So I waited for 3 or 4 months, repeated the dose, and was repeated 3 or 4 times in 1 year. And at last, after 1 year, she had been totally free. So now she can face the tents, shamianas. She can face the bad news. She can even hear the bad news in the mobile or see in the television. So nothing happens for her. This is the improvement I got after 1 year. I had, but even 3 or 4 times during this period, patients insisted me like anything, and I also tempted to change the remedy. బికాస్ ఏమన్నా ఇంకా ఏం మార్పు కనబట్టలేదు. ఇదివరకు ఎన్నిసార్లు చేసేవారు, ఇదివరకు 10 సార్లు చేశాను, ఇప్పుడు 2 సార్లకే వచ్చింది, అయినా అలా అనేవారు. సో ఏంటి 10 నుంచి 2కి వచ్చింది, ఇంకా పూర్తిగా తగ్గలేదు. బట్ స్టిల్ ఐ వెయిటెడ్ బికాస్ ఆ స్టేజ్ నుంచి ఈ స్టేజ్కి వచ్చినట్టు ఇట్ ఈస్ ద రెమెడీ, నో డౌట్ అబౌట్ ఇట్. సో ఇందాక చెప్పినట్టు కొన్ని ఇలా పిచ్చి పనులు చేస్తూ ఉంటాను నేను. In one of my cases, recently we will going to show you in our 6th row of the periodic table a cough case where I gave platina. It's a very acute condition, cough, but I took the case, it got into depth, it got into experience. So I gave platina for that cough case, where the cough improved dramatically, about 80%. Because 1 year back she got some violent attack of cough, and she was improved with some allopathy after 2 to 3 months. So now again this person got same cough. So there is some link between the past and the present. So it's not a purely acute condition. There is some delusion part. అలాంటి దగ్గు మళ్ళీ వచ్చింది, అలాంటి కండిషన్ మళ్ళీ వచ్చింది, సంవత్సరం క్రితం ఇంత సఫర్ అయ్యాను. సో then I understood that it's not a pure acute condition. We have to go to the depth of the case, and I took the case in the sensation method, and I prescribed platina with so much improvement. So like this selenium in this case, because the very idea is that we have to think like that. అంతేగాని ఆయన అలా చెప్పారు కాబట్టి ఇంకా అవే చూస్తాం అనకూడదు. So these masters are like torches, they will show the light, and it is us we have to travel. So respect your own ideas, your own innovative genius. There is nothing wrong in that. వాళ్ళు ఎవరు వేయలేదంటే మనం వేయకూడదని అర్థం కాదు. But it should be done with a submission to the feet of master, rather than with our heads. మన బుర్రలతో పని చేయకూడదు, మన వాళ్ళ పాదాల దగ్గరే ఉండాలి. సో అలా ఉంటున్నంతసేపు ఆ రకమైనటువంటి ఐడియాస్ కానీ ఆ రకమైనటువంటి వాటిల్ని కానీ మనం గౌరవించుకోవాలి. ఎందుకంటే అవి మన నుంచి వస్తున్నావు కదా, వాళ్ళ నుంచి వస్తున్నవే, మన ద్వారా వ్యక్తం అవుతున్నాయి అంతే. సో దీస్ ఆర్ ద కేసెస్. వై ఐ said about these cases is generally selenium in the materia medicas. We know all these things about the weakness of the sexual system, premature graying of hair, comparison with Beretta carb, comparison with silica. These are all written in the Soul of Remedies in the Kent Materia Medica. So there is nothing new to learn there. So you can study also directly from the books. What I want to give you is the clinical aspect of selenium. And one more case, the topmost case in my practice, it's about మా మామయ్యది ఆ కేసు. సో ఈయన అన్నమాట. సో మా అత్త ఏం చెప్పిందంటే, కన్నా మామయ్య అసలు చాలా దారుణంగా ఉంటున్నారు, ఎప్పుడు పడుకునే ఉంటున్నారు, అసలు లేవట్లేదు, ఏదో అన్నం తింటున్నారన్న మాటే కానీ ఇంకా అలా కంటిన్యూస్ నిద్రే, అసలు కాస్త అన్నం తింటున్నారు పడుకుంటున్నారు, అన్నం తింటున్నారు పడుకుంటున్నారు. ఈయన ఒక పత్రికా విలేకరుగా పనిచేస్తారు. సో జస్ట్ ఐ ఎంక్వైర్డ్ అబౌట్ ద డైలీ. ఎప్పుడంటే ఇది మంచి మిడ్ సమ్మర్ అనమాట. ఈయన రోజు పొద్దున్నే 10ంటికి భోజనం చేసి ఒక 3 కిలోమీటర్లు నడుచుకుని, ఆయనకి బండి రాదు, ఆటో ఎక్కరు. సో పొద్దున్నే అన్నం తినేసి 10 ఆ టైంకి ఆ పత్రికా ఆఫీస్కి వెళ్తారు. ఒక 5 గంటల పని ఉంటుంది, మళ్ళీ 3 గంటలకు అయిపోతుంది. 3ంటికి ఆయన మళ్ళీ అదే ఎండలో నడుచుకుని ఇంటికి వచ్చేస్తారు. ఇంటికి రాగానే కాస్త ఏదో టిఫిన్ చేస్తారు, లేకపోతే ఏదైనా పాలు టీయో తాగుతారు, పడుకుని పోతున్నారు. మళ్ళీ రాత్రి 8-8:30కి లేస్తున్నారు, భోజనం చేస్తున్నారు, పడుకుని పోతున్నారు. వెర్రి నిద్ర, వెర్రి నిస్త్రాణ, అది మా అత్త చెప్పింది. మరి అక్కడ పత్రికా ఆఫీసులో విషయం ఏంటంటే, ఈ మధ్య ఏదో తప్పులు చేస్తున్నారండి ఈయన, మగత వచ్చేస్తుంది, చేస్తూ చేస్తూ నిద్రపోతున్నట్టు అక్కడ కూడా, ఆఫీస్లో కూడా. వాళ్ళు కూడా కంప్లైంట్ చేశారు. సో దిస్ ఈస్ ద, సో ఐ గేవ్ ఫస్ట్ యాజ్ ఇన్ సమ్ కేసెస్ ఐ గాట్ విత్ లెసిథిన్, ఏదైనా మెంటల్ ఇది లెసిథిన్ 200 ఇచ్చాను, తర్వాత క్యాలిఫాస్ ఇచ్చాం, ఆనస్మోడియం ఇచ్చాను, యాసిడ్ పిక్రిక్ ఇచ్చాను, నథింగ్, నో రిజల్ట్. Then I understood that this is selenium aspect, where in Kent it was given. Please go through the Kent meter America, where there is so much enervation, so much loss of energy from the sun's heat. So I gave him selenium 200, with which he was improved very beautifully. So now he is okay. ఈ సెలీనియంతో ఈ రకంగా ఆలోచించడానికి నాకు ముందుకు ఒక అనుభవం ఉంది. ఏంటంటే మా గురువు గారు ఒక 7-8 ఏళ్ల క్రితం 2011-12 ప్రాంతంలో ఆయన పాకలో ఉండేవారు. ఆ పాక చివరిలో గట్టు పెట్టుకుని ఆ ఎండాకాలంలో ఆ గట్టు మీద కూర్చునేవారు, ఆ గాలి కోసం. కొంచెం ఆ గాడుపు తగిలేదనమాట, దాంతో విపరీతమైన చెమట పట్టేసేది. తర్వాత ఆయనకి కొంచెం ఈ బీపీ అది ఉంది, ఏవో రెమెడీస్ ఇస్తున్నాం, తగ్గట్లేదు, ఆర్ఎస్ ఇచ్చాం, ఇంకో గ్లోనైన్ ఇచ్చాం, సల్ఫర్ ఇచ్చాం, ఏమి ఇచ్చినా బాబోయ్ ఈ వేసవిలో చాలా ప్రాబ్లం గా ఉందిరా బాబు, విపరీతమైన చెమటలు ఇది అని చెప్పుకుంటూ వస్తున్నా. ఏం చేసినా అర్థం అవ్వలేదు కేసు. సో అప్పుడు ఇంకా చదవడం మొదలు పెట్టాం. అప్పుడు సెలీనియం ఫర్ ది ఫస్ట్ టైం ఐడియాలోకి వచ్చింది. తర్వాత అప్పటికి ఇంకా వాళ్ళ అమ్మగారు ఉన్నారనమాట, ఆయన అమ్మగారు. ఆవిడని కూడా అడిగితే ఆవిడ కూడా ఒక పాయింట్ చెప్పారు. ఏంటంటే వీడు చిన్నప్పటి నుంచి ఇంతే, తడిగుడ్డలు కప్పేసుకుని పడుకునేవాడు వేసంకాలం అంటే, లేదు నీళ్లలో బాత్రూమ్ లో తొట్టిలో నీళ్లు నింపుకొని అందులో పడుకునేవారు, అంత ఎండకి ఆగలేడు, అస్సలు సన్ హీట్ పడదు అని ఆవిడ కూడా మనకి కొంత ఐడియా ఇచ్చారు. అంటే ఇట్స్ నాట్ అన్ acute state, but it's a chronic state. So then in that mid-summer period we administered selenium for him, and with which that all the weakness, the perspiration etc. had much reduced. And even after those days, yes, there is some issue still remained, but after that year this part of the diseased condition was reduced very much. This is the first aspect where we administered selenium, where in that area, in that clinical aspect of heat problem, enervation, loss of energy, drained out, always sleepy, morose, couldn't rise up, not refreshed. These are the ideas from sun's heat, from the heat of sun, which was given in Kent Materia Medica. First para, please go through it. So these are 1 or 2 cases in the clinical aspect of selenium. So remaining selenium you can study in the books. There is that weakness of the reproductive system, erectile dysfunction, premature baldness, graying of hair, premature senility, fear of people, wants to remain inside, comparison with Paritacar, comparison with Staphysaicria. These selenium people will sometimes shout, like చాలా మంది స్టాఫ్సైక్రియాతో ఉన్న మిస్అండర్స్టాండింగ్ ఏంటంటే స్టాఫ్సైక్రియా పీపుల్ గట్టిగా మాట్లాడరు, వాళ్ళంతా దిగమింగుకుంటారు అని. అదొక రాంగ్ కన్సెప్షన్. స్టాఫ్సైక్రియా పీపుల్ విల్ షౌట్ లైక్ నక్స్వామిక, నో డౌట్ అబౌట్ ఇట్. మా చిన్నప్పుడు మేము మెటీరియా నేర్చుకునే కొత్తలో మాకు నేర్పినటువంటి పెద్ద మనుషులు కొంతమంది ఇలాగే చెప్పేవారు, నక్స్వామిక గట్టిగా అరుస్తాడు, స్టాఫ్సైక్రియా అస్సలు అరవడు, అన్ని దిగమింగుకుంటాడు అని. నో, ద ఐడియా ఈజ్ that Staphysaicria has raw nerves because it comes from Ranunculaceae family. So everything will affect them. Chakkati word vaadadu Kent. Great indignation about things done by himself or others. ప్రతి చిన్న విషయం వాళ్ళని స్పందింపజేస్తుంది. So much raw their nerves are, easily affected, greatly indignated. ఇవాళ అటెండెన్స్ లో నా పేరు పలకలేదు, లేదు ఎంతమంది వచ్చారు నా గురించి అడగలేదు. చిన్న చిన్న విషయాలు, అండ్ దే విల్ థింక్ లైక్ ఎనీథింగ్, అండ్ దే పెంట్ అప్ దట్ wrath, and at one day all this wrath will come out like an volcano. The stabsacria will people shout like anything on that particular day. It's not that every day it's going to happen, but on that day stabsacria will be. అందుకనే మీకు సోల్ ఆఫ్ రెమెడీస్ లో సార్ ఒకసారి ఓ చోట ఈవెన్ ఫోకస్ మీటర్ మెడికల్ కూడా ఆ పాయింట్ ఇచ్చారు, that stabsacria was compared with lysin, where there is violence, so much violence. The lysinum patient has so much violence, breaks things, bite things, shout things, destroy things. So staph is compared with lysinum. So see that in that particular day that violence will come out. But it's not going to happen each and every day. That pent up wrath will come at some day. So the laxitiousness aspect also, which is in both in selenium and staphseria, the impotency aspect, the masturbation aspect, mind revolving around the sexual sphere. So these are some of the ideas of selenium with comparison with other remedies. So and these selenium people does, because when it goes to complete right side of periodic table, these are the people who are not going to face the people. They are, even in the selenium patient which we discussed earlier, she never come out of her house. She don't know who was residing in that apartment, who was next to her door. ఎవరో కూడా తెలియదు. So much aversion to make contacts, so much fear to face people. You can call anthropophobia. So much dull, sluggish, drowsy, stupor, difficult memory, difficult concentration, loss of brain power, confusion. So these are be seen in the selenium people, because it is complete to the last of the periodic table. So this 17th column is like those people so much forgetful, so much dull, drowsy, etc. And definitely the row theme also will come along with the column theme. At one point, even this person said that the main issue is the economical background. They came from such poor economical background. So I am suffering from epilepsy. I couldn't do anything for family. So I am energyless, pranam lenattu. And when you come across this semen dribbling, nocturnal emissions, etc., please inquire about the mind state. Don't go through only this issue. So in one of my cases, where the person is telling from ages about this nocturnal emissions, and we are giving remedies after remedies, remedies after remedies, nothing is helping that patient, and this person is using from last 10 years at us. So finally, after going through repeated, then I understood that this is a case of diascoria. So with diascoria, he got completely cured of that nocturnal emissions. So all the issues are with the same ఎకనామికల్ ప్రాబ్లమ్స్ అండి. ఎలా ఎదుర్కొంటాం, టైంకి జీతాలు ఎవరు, నేను ముసలివాడిని అయిపోయాను, సెలీనియం సిమ్టమ్స్ అన్నీ ఉన్నాయి, ప్రిమెచ్యూర్ సెనిలిటీ. అండ్ ఐ వండర్ వై సెలీనియం ఈజ్ నాట్ హెల్పింగ్, బట్ హిజ్ ఎక్స్పీరియన్స్ ఈజ్ నాట్ సెలీనియం. Sir, at one point of time he said that what happens within you when that boss is not clearing. So it affects me so much. How did it affect you? తలపోటు వచ్చేస్తుందండి బాబు, ఆ క్షణంలో తల పట్టేసినట్టు ఉంటుంది. జస్ట్ ఆ పట్టేయటం గురించి చెప్పండి. దెన్ హీ షోడ్ విత్ జెస్చర్, ఇలా తిప్పేసినట్టు ఉంటుంది. Then I understood that it's a case of diascoria. So after diascoria, then this nocturnal. And one more thing with diascoria is that all this will happen without sexual thoughts. And this person has no sexual thoughts at all. Still, there are involuntary emissions during the sleep. So this is the understanding of the 16th column of the periodic table. Next time we will complete the bromium and we will go to the, after completing the halogen part, we will start the 5th row of the periodic table. Okay? Subharatri Angan. Gurur Brahma, Gurur Vishnu, गुरुर्देवो महेश्वरः, गुरुर्साक्षात् परं ब्रह्म, तस्मै श्री गुरवे नमः.